That means if any of the 60,000 people who travel this road every day were to get into a major car accident and need an orthopedic surgeon, they'd have to be flown over to Queens Medical Center. And the hospital has one of the largest operating rooms in the state. Now, high-tech cameras magnify the surgery, and they're shown on these monitors. Not all masks are created equal. A basic one like this does not prevent viruses from passing through. That's why you need a mask like this, a respirator mask, the N95, that will prevent swine flu and other influenza. One positive aspect of all this is that students are taking personal hygiene a bit more seriously. School custodians say they have to refill the soap dispenser a lot more frequently these days. Health officials say the concern is that airplanes have a closed air system, so if a passenger has swine flu, he could theoretically pass it on to others on that flight. This has become a common sight in Mexico and states that have confirmed cases of swine flu. Now they're starting to pop up at Hawaii airports. This woman says she wore a mask because she was coughing and didn't want to spread her germs.
I say good for her. You know, she needs to protect herself to feel comfortable traveling, then more power to her.
Air travelers have become more cautious ever since swine flu hit Mexico.
At first we were nervous. We actually went to the airport pretty early, maybe like 4 hours early, just to make sure that we go through the lines.
This couple just came home after visiting their son in San Diego, one of a handful of U.S. cities with confirmed swine flu cases. There were masks on the plane.
I think it's just an additional protection. And like I said, you don't know who's sitting next to you, where they came from, who they may have been exposed to.
With the number of swine flu cases going up, the Centers for Disease Control and Prevention has taken action.
CDC basically has activated its emergency operations center. They have activated their SNS, which is the Strategic National Stockpile.
This means they've declared a public health emergency, releasing large quantities of medications and personal protection equipment. The CDC is also working closely with the State Department of Health.
They're very well prepared for this kind of event. They've already activated their own systems and are doing a very good job in response.
And that response has people reassured for the time being.
I feel that the government, everybody's going to be able to take care of what needs to be done to keep everybody safe.
Good afternoon. How are you today?
Myra Barrientos works as a nurse in the pediatrics ICU unit. She takes care of newborn babies. It's a familiar environment for her. She's a mom and expecting her second child in October.
My husband and I always wanted to have a bigger family. My first son, he's just turned 2, so I think it's a good time. It's the right time for us to have another one.
She's going through her second pregnancy as swine flu continues to grow stronger in Hawaii.
Actually, on the mainland, most of the cities have seen a decrease in cases, but we are seeing a continual increase. And we are now expecting that, particularly as school starts, we will just continue to have influenza disease circulating widely in our community.
The Centers for Disease Control and Prevention is working on a swine flu vaccine. Among the first to get it are people in high-risk categories, like healthcare workers and expectant moms. Hawaii is seeing twice the number of respiratory-related hospital admissions than normal.
I've seen symptoms range anywhere from the mild flu-like symptoms to severe symptoms where their respiratory status is severely affected, to the point where they need to be placed on ventilators or breathing machines.
Pregnant women are at risk because they go through changes in their immune system.
The lungs are also compromised as pregnancy goes on, which means that people cannot breathe as deeply as the baby is growing inside.
This means pregnant women must take extra good care of themselves.
Not only do you have yourself to take care of, you do have this unborn child that is really expecting you to take good care of yourself, so that you don't want anything to happen to this child. You've already gone through several months trying to be the healthiest as you can.
Staying healthy so moms can deliver healthy babies like twins Brock and Solomon Kiamahoe.
So how long have you been sick? Here, about 2 weeks, actually.
Orpheus Dillard is a patient at Kona Community Hospital. He's noticed a shrinking population of doctors on the Kona side.
It's going to be a major crunch. I mean, I think people are really going to suffer. We may have a lot of our population leave because of that.
Surgeons like Dr. Larry Peebles say the problem is Hawaii has one of the lowest reimbursement rates in the country.
If I'm expected to go do some work and I'm being paid at a rate that doesn't cover my costs, I'll stop offering that service.
That means patients have to go off-island for complicated, potentially life-threatening illnesses.
If you look at the statistics on the island of Hawaii, we're in the state, we're the worst in strokes and cardiac care in terms of final results. And the reason that is because there's delays in treatment.
The high cost of malpractice insurance is also driving doctors away. It's about $150,000 just to defend a lawsuit.
So every time someone sues a physician, whether they win or lose, it costs $150,000, which comes out of my overhead, which of course bounces back down to the patient.
So the Kona side is underserved, especially with specialty care. In January, Dr. John Bellotti was the only orthopedic surgeon taking calls in Kona. Just last week, another began practicing there.
Any 1 month could seem like the gun lap in a race. You could go faster and faster and faster, but then you have another month and another month and another year.
He and others advocate medical liability reform similar to measures that transformed healthcare in Texas. Before voters there passed a tort reform law in 2003, 9 orthopedic surgeons closed their practices over 3 years. Since then, Texas saw a dramatic jump in the number of orthopedic surgeons, attracting more than 100 in just 2 years. Doctors say something similar could work in Hawaii, but patients must get involved.
When the patients stand up and let the legislature know that they will vote them out if they don't take action, then I think there'll be action.
Mike Brewer loves living in Nanakuli. He's called this beach home for the past 2 years. While he enjoys his freedom, he has to take care of his stuff.
Things I do value, I got to take with me. I cannot really trust people because they'll go through my stuff like it's a rummage sale.
Life can be tough when you don't have a roof over your head and have to rely on Mother Nature. But beyond that, there are major health concerns. Unsanitary conditions and lack of access to regular hygiene make the homeless vulnerable to infections. Recently, Mike was bit by a bug and got MRSA, the potentially deadly bacteria strain resistant to antibiotics.
It cost me 6 weeks in a hospital. I had to have this real heavy-duty antibiotic that I had to stay on to get the infection out of me.
Mike's not alone. Hawaii leads the country in MRSA infections, and it's impacting our homeless population at an alarming rate.
And what we found is that almost a surprising number of homeless people with wounds of any sort recover Staphylococcus aureus.
72% had staph infections, and about 80% of those had even a stronger epidemic strain called USA 300.
About 19,000 Americans die each year from MRSA infections, which is more than the number of people that die of AIDS.
MRSA is a global problem, and doctors from all over the world are on Oahu to talk about how to fight it. Until they find a way, folks like Mike try to minimize their risk.
Watch out when I do get cuts and what I pick up and stuff like that. But you're bound to get accidents, so it's just life you have to deal with and cope with.
Leland Kim, KHNL and K5 News.